I wish I had a simple answer to that very important question. My first notion is to suggest that I wish more primary care physicians would have the ability and the time to measure the behaviors, to measure physical activity or cardiorespiratory fitness and nutrition. Even that is very difficult to do. We have just finished a large study, and others have as well, where we've tried to incorporate kinesiologists into the family health team. And it is the kinesiologist that would implement the behavioral-based program, the objective of which would be to increase physical activity and to consume a healthful diet. The results of our study and other studies are quite sobering, in fact. While in the first 6 months to a year, we see the adoption of these behaviors and accordingly a reduction in body weight and a reduction in waist circumference, to be fair, we begin to see an erosion of that benefit in the second, third, and fourth year. So the good news is that when you have a properly trained individual working side by side with the clinician, the primary care physician, we are seeing benefit. That's the good news. But I think we have to be realistic in terms of the size of that benefit. When we do exercise combined with a healthful diet under strictly controlled laboratory conditions, we see 30% reduction in abdominal obesity and substantial improvements in cardiorespiratory fitness. When we now try and change that behavior, tell people, try and determine using cognitive behavioral techniques how to get them to adopt those behaviors in now the environment that we call the obesogenic environment, that's a much greater challenge. So we're going to have to recognize that major changes in behaviors are going to be difficult, and that perhaps a benefit of these programs in clinical practice is to prevent further weight gain or further gain in waist. So we have some work to do there. It's no simple answer on what to do in clinical practice. Certainly in Canada, and I would say in North America, many physicians don't have the time or the expertise to do it themselves. So we're going to have to help them in some way. We're working on those models, as are many individuals. So far, while we're seeing positive results on adding to the healthcare team, using things like the internet and Facebook and various ways of communicating cost-effectively behavioral change techniques, we've got much to learn. To be truthful, we have much to learn. We're making progress, but we have a long way to go.